So this person starts out about 1.5 inches forward, tons and tons of stretch here. Their FIQ score was an 82. I mean, this person was really, really sick. Couldn't hardly get out of bed, couldn't hardly function, and in lots and lots of pain. Then, this is when we were done working with her, then this person is now only 16 millimeters forward. See how their neck is curved. So you'll see now that you've got a curvature starting here, pretty good curvature in their head forward. Their head carry is now back to 16 millimeters, which anywhere up to about 10 millimeters or 1/4 of an inch is pretty normal, okay? And just by doing that much work with them, their FIQ score went down to a 22, okay, where they have virtually no pain. They have energy now. They don't have their brain fog anymore. They're functioning very, very well on a very high level. Here's another example. This person starts at a 13-degree curvature. They start with a 33 millimeter, so about 1.25 inches forward head carry. And then once they've gone through the program, now they've got a 41-degree curvature, reminding you that 44 is like, you know, a textbook perfect curvature. And their forward head posture is now down to 6 millimeters. Their head is sitting right above their shoulders where it's supposed to be. All of that stretch has now come out of the spinal cord and off of those muscles and things, and everything is allowed to relax. As the spinal cord relaxes, then their body starts to heal, and they started at a 60 FIQ score, and now they're down to an 8. Okay? So that's the end of the webinar.
Thank you very much, Dr. Kingston. We appreciate the information you have given us tonight. A lot of people with fibromyalgia want to understand what may be happening when they have significant neck pain. Several people sent in questions. We'd like to have those answered now.
Okay, so I just wanted to clear something up real quick, but if you guys look, you'll see a little box there that says questions that has a little plus there. So if you guys want to ask specific questions now that you've heard a little bit of what we're doing and stuff, if you want to type those questions in and send them over, then I'll see them here in a second. It takes about 30 seconds or so for those questions to start coming through, and then I can answer your specific questions, and we'll be here, you know, 15 minutes or so, and we'll answer questions. And while those are coming through, then I will answer some of the other questions that have come. A lot of these questions were already covered in the webinar, but I'll talk to you about this, okay? It says, my neck pain is progressively getting worse, and I'm having an increase in migraine headaches to the point my Imitrex isn't helping. My doctor only has me on Tramadol and Flexeril, but Tramadol isn't enough. So basically your question is, where do you go from here? Well, the first thing I would say is that the reason, if you notice, usually your fibromyalgia doesn't stay the same. It's either slightly getting worse or it gets worse a lot quicker, okay? And the reason that it's getting worse and worse as time goes on is because gravity is out there, and as your head is sitting forward, it just keeps pulling your head farther and farther forward and causing more and more stretch on the spinal cord. And so as that goes, and that's what's making, is that you get more and more stretch, now you're getting more and more of the symptoms of fibromyalgia. It will get to the point where the head aches. Now, there's one thing that I didn't bring up because I didn't have a time really, but you'll notice that a lot of your pain in your neck is right at the base of your skull, okay? And what we found in looking at x-rays and stuff through the research we're doing is that in over 98% of the time that a person has this, in fibromyalgia, when I take an x-ray and I look at a lateral view, and I'll kind of show you, see if I can show you what I'm talking about on one of these pictures. Let me do this while I'm waiting for questions. Okay, if we look at this normal x-ray of the neck again, well, that's not going to show it. But anyway, the relationship between the base of the skull right here and this first vertebra here and the second vertebra, those three vertebrae on the base of the skull, they should run parallel. But what I see in fibromyalgia, 98% of the time, the occiput or the skull is actually locked forward. And it happens because of a whiplash effect. As the head slides forward in a whiplash, the body will go into a protective mode and it will lock that head kind of in a forward motion. And what that does is now you've got all this pain and all this problem and stuff right at the base of your skull. And so one of the first things we had to develop to help patients was a way to take care of that that lock that's doing on there. And so that's one of the basic first steps of things. Okay, so another question. It says, I broke my neck in 4 places in 1992. I had surgery, and now I have widespread fibromyalgia. The last few years, my neck pain has caused me serious migraines, enough to blind me. Okay, she's using pain patches and everything, and she's looking for some ideas. So the reason I bring that up is because even though you've had surgeries, a lot of people have had these surgeries in the past. Depending on where those surgeries are, it's going to determine how much better we can help a person get. And if a person has their whole neck fused from top to bottom, obviously this curvature is not coming back. But if it's at 3 levels or 2 levels or 4 levels, then we're able to, through the program, so you're able to get this curvature restored. And maybe it won't get back to a perfect 44 degrees, but it might get back to like 28 degrees. And when you get that curvature back to that much, then it's at least able to withstand gravity, and you'll have, a 78-80% reduction in your symptoms. It's just that you'll have a certain amount of exercises that you'll have to do for your entire life to maintain that. Whereas someone who can restore this curvature, if they're able to restore it the whole way, then they don't have to do a lot of maintenance exercises in the future, because now it's strong and it will hold there, and it's posturally how it's supposed to be. Okay, we got a couple questions coming through here from you guys. Going on with this, it says, the next one says, I've been diagnosed with fibro, and after many years of suffering with the aches and pains, I raised my children. This is the stuff that I hear from a lot of people. You're just pushing through this, and it's awesome that you're able to do this. She wants to know if, other than ibuprofen and heat packs and things, what else she can do. You've probably noticed that your exercise, and when you do exercise and things, that it flares you up. You go to physical therapy. A lot of people have been through physical therapy programs, and it mostly just flared them up, because this isn't a muscle problem. This is a nervous system problem that's making the muscles and all this stuff have an issue. So you want to avoid exercises and different things that are going to create more stretch on your cord, okay? So some of the things you want to avoid are, you don't want to hang your head in extension, like looking up towards the ceiling. You don't want to put your head back, because that'll cause more stretch. If you need to look at something or find something under a bed, you need to roll down onto your side and look under that bed, instead of, if you're on your hands and knees and you look under the bed, you tip your head back. That's going to flare things up some more. If you go to the dentist, you need to bring like a towel or something that you can put under your neck and support your neck as you're doing that. If you go to get your hair cut, you need to make sure that you bring a towel or something to put on that sink, so that you don't lay there with your head back over that sink for 10 or 15 minutes. That's going to cause a major flare. Most of the time, people will go into surgeries, and they come out from these surgeries and they've got crazy amounts of fibromyalgia, and it's because they put your head and your neck in such a weird position, and you lay there during that surgery for hours, and then you come out and it's completely stretched and flared this thing up. So if you have to go into these minor or major surgeries, whatever it is, you need to ask the doctor, ask the people before you go under, to put a rolled towel under your neck or something to support that, so that you can keep that curvature as good as possible and keep that neck supported. That'll help you out a whole lot when you're doing that. And let's see. This person's been told to go use cold packs and go from cold to heat to cold to heat. That can be helpful in certain situations, but what you're dealing with usually with fibromyalgia, unless it's an acute flare-up, you're looking at something that's chronic. And so usually what's going to be the best, if you're going to use ice and heat, is mostly just heat, and moist heat is even better, okay? So if you have a way for to soak in the tub or stuff like that, that moist heat's going to help your muscles and stuff feel better. And realizing that that's just a temporary relief, because what you really have to do is get this mechanical disadvantage taken care of. You need to get this stretch off your spinal cord to get this pressure off your nervous system, and that in turn is going to help you get better. I think I've answered any of the questions that have come through. Anyway, so I'll turn this back over to Jan.
Thank you to our presenter and our guests for joining us tonight for the National Fibromyalgia and Chronic Pain Association's Ask the Expert webinar. This will be posted on our website and on YouTube next week.